Hi, welcome to Lecture 9 covering Chapter 9 of Focus on Personal Finance. Tonight we'll be looking at health and disability income insurance. You know, they say you should never talk about religion or politics at a dinner party, but I think we would be safe to add health insurance or health care to that list of topics. Excuse me. Regardless of your opinion on health care and health insurance in today's economy, it is a topic that you need to have the basic facts about, and that's what we're going to learn in Chapter 9. Planning a health insurance program needs careful study because the protection should be shaped to your individual needs. However, the task is simplified for many families because the foundation for their coverage is already provided by group health insurance at work, which is where most of us get our insurance. So we'll begin this chapter's review by recognizing the importance of health insurance in financial planning, and then also defining health insurance. Then we'll analyze the benefits and limitations of various types of health insurance coverage. We'll also look at the importance of disability insurance in your financial planning and identify resources for disability insurance. Finally, we'll explore why the cost of health insurance and health care have been increasing and what can be done to curtail some of those expenses. So let's get started by looking at our learning objectives. There are quite a few this evening. I'll try to move through these quickly. The first learning objective is to recognize the importance of health insurance in financial planning. Health insurance is protection that provides payments of benefits for a covered sickness or injury. Health insurance should be part of your overall insurance program to safeguard your family and your economic security. Objective number 2 is to analyze the costs and benefits of various types of health insurance coverage as well as major provisions in health insurance policies. There are 4 basic types of health insurance that are available under group and individual policies, and we'll look at those. Learning objective number 3 is to assess the trade-off of different health insurance plans. So health insurance policy trade-offs include reimbursement versus indemnity, internal limits versus aggregate limits, deductibles and co-insurance, and out-of-pocket limits. So we'll look at some of these items together tonight. On to learning objective number 4. Evaluate the differences among healthcare plans offered by private companies and by the government. So health insurance and healthcare plans are available from private companies, from hospitals and medical service plans, such as Blue Cross and Blue Shield, from health maintenance organizations, from preferred provider organizations, from point of service plans, from home health care agencies, and from employer self-funded health plans. And we're going to look at those because those will be important to you as you make decisions throughout your life. We'll also briefly look at Medicare and Medicaid. Okay, learning objective number 5. Explain the importance of disability income insurance in financial planning and identify its sources. So disability income insurance provides regular cash income lost by employees as the result of an accident or an illness or even pregnancy. Learning objective number 6. Explain why the cost of health insurance and health care have been increasing. We'll look at why healthcare costs have gone up faster than the rate of inflation. All right, so let's get started. Learning objective number 1. Recognize the importance of health insurance in financial planning. So health insurance is a form of protection with the primary purpose to alleviate financial burdens suffered by individuals because of illness or injury. It includes medical expenses as well as disability income insurance. Different types of health insurance. We start with a group plan. Now, group plans are typically employer-sponsored, and employers pay some or all of the premiums. So it's getting harder and harder to find employers who are paying all of the premiums. Probably heard of the Health Insurance Portability and Accountability Act, which is often called HIPAA. This is a set of federal standards to ensure that workers would not lose their health insurance if they change jobs. And this is really important because most of us are insured through our employer. So as we change from job to job, we want to make sure that we have seamless health coverage. With HIPAA, this allows you to do that without being penalized for pre-existing conditions. Another reason why that's important, let's say that you have a pre-existing condition such as high blood pressure, or you have a child who's ill. You don't want to not be able to change jobs because you are concerned about the insurance company putting what's called a rider on your policy, meaning that yes, they'll cover you, but they're not going to cover anything that has to do with your high blood pressure because you had that at the time that you took the job. So this is really an important act that protects us. To your group policy, you can purchase a group policy supplemental insurance. However, it's notable that it's limited to only 100% of allowable medical expenses. So if you have a policy, it's going to cover the difference between what your current policy, group policy, pays and then what that policy provides for, but you can't make money on being sick. It limits it to only 100% of the allowable medical expenses. So you'll never be reimbursed more than what your medical expenses really were. Insurance that's available to you is an individual health insurance policy. Though I know that our book says that these are available to you, I have to say that my husband and I went through a period of time in the last couple of years where we had to purchase an individual health insurance plan, and what we found is that they're very pricey. They don't cover very many expenses, and what policies that you get through a group plan and through an employer are normally a much better policy at a better price and better coverage than what you can buy in an individual health insurance. The reason my husband and I had to purchase individual health insurance is because he lost his job through downsizing, and we were insured through his insurance with his position. We were happy to find out that for a period of time we were covered under what's called a COBRA, which is Consolidated Budget Reconciliation Act of 1986 and abbreviated as COBRA. It requires many employers, though not all, to offer employees the option to continue their group coverage for a set period of time following a layoff, and we were able to participate in that. But once again, I have to say that the price of our insurance, even though we were through COBRA and we were able to continue the current plan that we had under his old employer, it was at about 4 times the cost of what our insurance was when he was an employee. So though it will protect you, if you have a medical situation, it can also be very pricey. Move on to learning objective number 2, analyze the cost and benefits of various types of health insurance coverage as well as major provisions in healthcare insurance policies. So there are several types of health insurance coverage that are available under group and individual policies. These are basic, major medical, and both. We'll look a little bit closer at these. Health insurance will cover hospital expenses, surgical expenses, and physician expenses of your policy, because even though you have basic health insurance that covers these different items, chances of them covering it 100% are pretty slim. You would have a pretty outstanding policy. So there's going to be maximums and there's going to be percents that you're responsible for. So you need to be familiar with the insurance policy that you have. Your medical expense insurance protects against large expenses of a serious injury or a long illness. It may, however, have what's called a stop-loss provision. Chances are you're going to have a deductible with your major medical insurance, and there's probably a part that you have to pay as part of co-insurance. But the good news is that to keep you from losing larger amount of money through expenses that weren't planned for, a stop-loss provision protects you, because after you've paid a certain amount, your insurance company pays the remaining 100% of expenses. So let's just say that your stop loss is $5,000, which seems like a lot of money, but when you get into medical, it doesn't take long to spend that much. So once with your deductibles and your co-insurance, you've hit that $5,000 amount with stipulations outlined by your policy, then for anything above that $5,000, the company covers at 100%. So it's really wonderful if your policy has a stop loss, because it does protect you from having huge medical bills if you would have a major injury or illness. As a supplement to other healthcare plans, you can have hospital indemnity policy. This pays benefits only when you're hospitalized, but rather than paying them to the money out to the hospital, it pays it directly to you. Normally it pays you a fixed amount for each day that you are hospitalized. You may also have the opportunity to purchase dental expense insurance. Dental insurance provides reimbursement for expenses of dental services and supplies. Normally, they'll cover things like your cleaning and x-rays. If you have to have a root canal or things like that, normally it'll pay a portion of that. And normally there's a max per year on that as well. So once again, just know the limitations of your policy. Also find vision care insurance, which will help to offset the cost of contact lenses and glasses if you need those, and even just your regular exams. Now, the book refers to a dread disease policy, but you probably have heard of cancer policies, and that's what they're more commonly called. A dreaded disease or cancer policy is usually solicited through the mail or newspapers or magazines or door-to-door salespeople. And the reason I'm mentioning that is because they're really pretty much notoriously poor values. So it is very specific in what it covers. They're usually fairly expensive considering the coverage that you're getting, and you would be better off to use your money for a broader cover plan that would cover cancer, but not only specifically for cancer. So be careful about those types of policies. Long-term care insurance is day in and day out help that if you would need it due to an illness or disability, it lasts for a long time and leaves you unable to care for yourself. It would actually cover the costs of in-home health care or a nursing home. And I did have a family member who had a stroke at the age of 50, and she had this kind of insurance, and it was a lifesaver for them because they were able to get her the care that she needed long-term in their home to care for her, so that her husband was able to continue working. So I am a fan of long-term health care insurance. Learning objective number 3, assess the trade-off of different health insurance plans. A health insurance policy, one of the things you want to look at is reimbursement versus indemnity. Reimbursement pays actual costs, where indemnity pays specific amounts, regardless of how much the actual expense may be. So watch for the use of the word indemnity in your policies. Another trade-off that you need to consider is internal limits versus aggregate limits. A policy with internal limits will cover only a fixed amount for an expense, such as the daily cost of a room during a hospital stay, where an aggregate limit will limit only the total amount of coverage, such as $1 million in a major expense benefit, or it may have no limits at all. Whether the policy has deductibles or co-insurance. So a deductible is just that. It's how much you have to pay out of pocket before your insurance kicks in. Where co-insurance, your policy will state what percentage of the medical expenses that you have to pay in addition to the deductible amount. So make sure you know what your limits are on both of those. Some policies limit the out-of-pocket expense that you have. After you reach that limit with the deductibles and the co-insurance that you pay out, then the policy pays 100% of any additional costs. And finally, you need to know whether or not your policy pays its benefits based on reasonable and customary charges. So some policies consider what's the average fee for that service that you're getting in your geographical area, and then they set limits based on that. So I had insurance on dental, and they never paid the entire amount. He must have charged more than what was reasonable and customary for the area where we lived, because I always ended up having a balance left over that the insurance company wouldn't cover because they said it was in excess of reasonable and customary charges. So as long as we went to him as a dentist, then we had to pay that additional amount out of pocket because it wasn't covered by our insurance policy. Moving on to objective number 4, evaluate the differences among healthcare plans offered by private companies and by the government. Insurance is available from private insurance companies, from service plans, from HMOs and PPOs, from government programs, and from fraternal organizations and trade unions. So looking at private health insurance companies, most private health insurance companies sell health insurance policies to employers, who in turn then offer those benefits to their employees and their employees' dependents as fringe benefits. Hospital and medical service plans are what define Blue Cross and Blue Shield. Those are pretty common names. You've probably heard of them before, but Blue Cross is hospital care, while Blue Shield is surgical and medical services. HMOs and PPOs are becoming more and more commonplace, and the reason is because they're considered managed care. And what I mean by that is that an HMO is a health insurance plan that directly employs or contracts with several physicians, surgeons, dentists, and optometrists to provide you with healthcare services in exchange for a fixed prepaid monthly premium. The focus is usually on wellness and prevention, and you can get an HMO for either your basic coverage or for supplemental services. While a PPO is a preferred provider organization. Those provide the services of doctors and hospitals at a discount rate or give breaks in the copayments and the deductibles. Though a PPO usually has more physicians and services to choose from than an HMO does, you're also going to pay more for a PPO. A point of service plan is a combination of the features of both the HMO and the PPO. A home health care agency provides the supervision and management of preventative medical care in a home setting in accordance with medical orders. Because of the percentage of people that we have in our society right now that are baby boomers and are aging, this is a huge market right now, home health care providers. And once again, I'll refer to my family member who had the stroke and needed in-home health care, and this was the type of agency that they worked with. Another kind of private health care plan is an employer self-funded health plan. This is where a company considers itself self-insured and puts back money, collects premiums from employees, and then pays those medical expenses from what they've collected and what they've contributed. So rather than using an insurance company, they are basically acting as that insurance company. Let's look at healthcare accounts. These they were authorized beginning in 2003 by Congress. My husband and I have found that this is a great tool to reduce taxable income. So I would take a second to go over these and see which one might be the best for you or fit your situation, because it can help you to save on your taxes. So the first one is an HSA, or a health spending account. It allows you to contribute money to a tax-free account that can be used for your out-of-pocket health care expenses. An HRA is a health reimbursement account. These types of accounts are usually funded solely by your employer, and they're normally tied to high deductible policies. The FSA is the flexible spending account. That's what my husband and I have utilized for years, and have found it to be a great tax benefit for us. It allows employees to contribute pre-tax dollars to an account, and then the funds are managed by the employer. However, it is notable that if you don't use all of the funds, it's forfeited at the end of the year. So you have to be careful about how much money you put back. Looking at government health care programs, there are two different kinds. There's Medicare and Medicaid. Medicare is a federally funded health insurance program for people who are 65 years of age or older, or people of any age with a permanent disability, as long as it's qualified. Medicare has 4 parts. They're called Part A, B, C, and D. A is for hospital, B for medical. C combines Part A and Part B, and then Part D is your prescription drug coverage. Contrary to popular belief, Medicare does not cover everything. The patient is liable for the difference. And Medicare does not cover some medical expenses at all. So it just depends on what the medical expense is. That is one reason why Medigap insurance is so popular. Insurance is intended to supplement Medicare. However, it is not sold or serviced by the federal government or by state government. So many private insurance companies sell Medigap insurance, and if you're interested in supplementing a Medicare plan, you would need to go to a private insurance company. And that if you or if a person is low income person who is eligible for Medicaid, generally they don't need Medigap insurance. Medicaid offers insurance to certain low income individuals and families. Typically it covers things like physician services, hospital services, lab work, prescription drugs, those types of things. Disability income insurance. That takes us to our learning objective number 5, which is to explain the importance of disability income insurance in financial planning and identify its sources. Disability insurance provides benefits should a person become disabled by accident or by illness. There are generally 2 different kinds of disability insurance. There's long-term and then there's short-term. Short-term disability insurance covers a person within the first 6 months of an illness, depending on how the policy is written. So it's written for a shorter term period, but it is written for a shorter term illness. For a long-term disability, normally doesn't take effect until after the policy has been, until the person has been disabled for 6 months. Once again, depending on the policy, and then that is designed to go out from that point forward. So that's the difference between short-term and long-term disability insurance. There are 4 major sources of disability income. There's private income from an insurance program, there's an employer plan, there's Social Security, and workman's comp. So workman's comp covers you if you've had a disability from on-the-job accident or illness. An employer plan could offer either short-term or long-term group disability policy or both. Sometimes they will offer one at a cost to you and another is considered part of your benefits. I know for me, I have to pay for my short-term disability, but my long-term disability is part of my benefit plan. You can also get Social Security disability if you have been disabled by their definition for more than 12 months, but they'll go back and start paying you at the 6-month point. And then there are private income insurance programs that you can purchase, and normally these will provide 40 to 60% of what your income is. So let's just say you make $1,000 a week, it might pay $400 to $600 of your income during the period of time that you're disabled. We bring this lecture to a close. Let's look at our learning objective number 6, which is high medical costs. Laundry list of reasons why we're experiencing such high medical costs. But it is notable that the data that we have is that in 2014 there was medical costs that equaled $3.09 trillion, and that the United States has the highest per capita healthcare costs of any country in the world. Even so, healthcare costs are projected to grow another 5.8% annually through the year 2022. Though this slide doesn't begin to cover the entire laundry list of reasons why, there are a couple that are notable. One of them is sophisticated technologies. Americans, as we demand better healthcare, it comes with a price. So as we get new technologies in, and hospitals, doctors' offices feel that they must keep up with these technologies, they purchase these at higher prices, which of course then push up our prices of care. Another reason is because we have such a high percentage of our citizenship that's falling in the baby boomer generation, and as we have more people aging and living longer, it's pushing up the price of our health care. There are tons of regulations in the healthcare industry, which costs the hospitals and doctors' offices more money to meet those regulations, and then of course that savings, quote unquote savings, haha, is passed on to us. So anytime that there's an increase in what their expenditures are, we're going to see that in the price of our health care. There has been an increase in emergency room treatments. Whenever we are ill or injured, we have a tendency to go to the emergency room for treatment, even though sometimes an urgent care or other facility might be adequate. Whenever we do that, we're pushing up the cost of not only our health care, but the total cost of health care in general. And the last one that we'll touch on here is just malpractice. As more and more people sue for malpractice, that pushes up, of course, the cost of healthcare because it pushes up the price of malpractice insurance, as well as suits being settled, and that pushes up the cost of healthcare for all of us. So I'm not on one side or the other. These are just some items that the book pointed out, so I brought those out to discuss. But once again, the list is long, and as we started this conversation by saying something you don't want to talk about at a dinner party is probably healthcare, and the reasons for high cost of healthcare is probably something you don't want to talk about at a dinner party either. Slide. So what can you do to reduce the cost of your personal healthcare expenditures? And the best way to avoid the high cost of getting sick is to stay well. And the more things that you can do to help yourself to be healthy, the better chance that you'll have of not having higher healthcare costs. So eating a balanced diet and keeping our weight under control is really critical to good health. Avoid smoking and being around smokers. Watch how much that you drink. Don't drink excessively. Take care of yourself. Everybody needs time for rest and relaxation and a little bit of exercise. Make sure that you're getting a sufficient amount in your schedule each week. Be careful when you drive and protect yourself from medical ID theft. In closing, I wish you good health. Don't forget that the full deck of these PowerPoint slides are posted for you. There's a couple of additional supplemental videos that you might want to take a look at. And as always, I'm available should you have questions or comments.